To Gillian, who is the Care Minister at the Department of Health and is on the line. Good morning to you.
Good morning, Justin.
Just outline, first of all, what exactly the rule is in England now, what you have to do and what you are not allowed to do.
Well, what you have to do is from the moment you get symptoms or test positive, you have to isolate. And on day 6 of your isolation, you can take a lateral flow test if that's negative. And then day 7, take another one. And if both those tests are negative, then you can come out of isolation. Although we still urge everybody actually to be cautious, obviously. But it's using testing more effectively, really, to serial testing to be able to reduce the isolation period.
Right. That's all very plain. When you say urging people to be cautious, though, where does that leave two groups of people? The first is hospital doctors. How cautious do they have to be? Can they go back to work?
Yes, they can, but they have to. I mean, there's a big testing regimes in the health and care sector anyway. Obviously, they're dealing with very vulnerable people. So they have PCR tests regularly. They have a number of lateral flow tests per week already. So what we urge them to do is just to continue with the lateral flow tests, because obviously they're dealing with people who are more
right.
vulnerable.
But
if
they do continue with lateral flow tests, they can and should. If they're not feeling ill and they've tested negative twice, they can go back, into intensive care settings immediately?
Yes, they can go back to work. But as I say, in those settings anyway, you have a testing regime anyway, with or without whether you've tested positive previously.
Sure.
So they are, and we have those testing regimes and we have had them all along. And obviously most people in that setting are boosted now. And obviously we're trying to, ensure that we use all of the tools.
And there's one other group of people as well I wanted to ask you about, which is people who work in care homes. So again, if they come out early from isolation under this new regime, that they can go straight back in and do the work that they were doing in care homes, including being close to people there.
Yes, and as I said, they have to take a PCR test every week. They have to take 3 lateral flow tests every week anyway. And obviously we'll just say to them, could you take a lateral flow test for those last 3 days, just to keep checking that you're negative. So already we have high testing regimes in place. Sure. Because of the vulnerability of people they're dealing with.
How much difference do you expect it to make in both those settings, actually, in hospitals and in care homes?
Well, obviously, it will relieve some of the pressure, but, obviously we still have to, monitor very closely, because we know we had, in the care sector, for example, we had quite a lot of vacancies already. So we do monitor that very closely.
One of the suggestions is that from those who would want a circuit breaker now, who would want stricter measures now in England, is that actually the reason is that the staff shortages in both the NHS, in hospitals, but also, crucially, in care homes are so bad now that never mind whether Omicron turns out to be more harmful or less harmful, actually we have reached a stage where in order to allow people to do their jobs decently and properly, we ought to be doing everything we can, more that we can, to reduce the incidence of COVID.
Well, we are. That's why we've rolled out the booster programme as quickly as we can. But we're also,
but we could do more.
The
point is that we could do more. We could shut down society more, with all the costs that would have. But what the case that they make is that actually we need to do that because in care homes and in hospitals we've reached a crisis point.
Well, we look at that data every day, every absent level in every part of the sector, in every part of the system, and the impact that's having, and also whether we have the local resilience forums in place as well. So we have contingency plans. We haven't yet had to activate a lot of those contingency plans. They are in place. So, we're looking at that data. We take it all into account. We're not at that point.
When it comes to the seriousness of Omicron, or whether or not it's milder, the Politico website is saying this morning that the UK Health and Security Agency is going to publish its first real-world data on the severity of it before Christmas. They say they've been told that experts are going to be quite positive, actually, to say that it appears to be affecting us more mildly than Delta. Is that your understanding?
Well, that's one of the missing pieces of data that we've been waiting for. We ask for it every day. I'm looking forward to receiving it, but we haven't received that officially yet. But of course, that's one of there's a lot of uncertainty in the data, and that's one of the pieces that we've been wanting to hear more on.
Gillian, thank you.
Thank you very much.